Well, it's nice to meet you.
Nice to meet you too, as
I
well.
was just, I'm debuting my new look with these glasses.
It looks pretty cool.
Thanks, man. Yeah, just tried to
Yeah,
switch it up
man.
since I'm losing my own hair, so I gotta make adjustments myself, you know?
I hear
So,
that. I definitely hear that,
so tell me, man, what
man.
can I help you with?
Yes, I was interested on the prices of a beard transplant. I was speaking to your assistant about it, and I was telling her I wanted a roundabout price on. Well, maybe you can determine obviously how
Well,
much I
let's take a
would
step
need.
back. Sort of, what were your goals? Like, what areas did you want to fill in with hair? You know, what kind of look were you
Um,
going for?
a full beard look, if that's
Hmm.
possible.
And
Yeah,
how many days have you gone without sort of shaving at this stage?
I don't shave. I
Oh,
don't
I
shave.
gotcha.
Yeah,
Okay.
yeah. I'm not
And
a too much of a hairy person at
right,
all.
right, right.
Yeah.
Were you hoping for like the cheeks to have the hair as well as the goatee, sort of the whole
Hmm.
area?
Yeah, the whole area.
Yeah.
So you think that's possible?
Yeah, I mean to some degree. So, and then were you looking to increase fullness in the goatee or not necessarily? You just want
Yeah, yeah. You can the whole 9 yard.
the whole nine
Yeah,
yards. Okay.
yeah.
Yeah, so here's the thing. So when someone starts off with not, too much facial hair and when they want a lot, you just have to realize it's never going to reach the type of density as
Okay.
it would be with someone who's already starting out with a good amount of hair and we're just like adding in between, right? So
Right,
like here, I could give you some solid, density, at least
right, right,
improved density because you're already starting out with, a decent kind of starting point, right?
right.
Um, and someone asked the question, where do we take the hair from? We'll get into that as well. But
Hmm.
the idea is when you don't have any hair in an area like on the cheek, or for some people, a whole area on the scalp is bald and they're looking for, improvement there. It's very hard to achieve any significant density, when it
Okay.
looks like kind of like your head looks, right? So
Right.
you just have to be reasonable with the expectation. So if you're hoping for
Okay.
a look that's as full as the hair on your head, it's really impossible for this
It's
whole area, even if we did sort of like the maximum number of grafts. So for a pretty, wide area that we're kind of treating here, and if we're doing the goatee, you're looking at least 2,000 grafts, which is a lot because each graft will contain usually at least two hairs in it,
okay.
right? So it's a lot of grafts. I mean,
Right, right, right.
you can't really cut corners if you want like a really kind of fuller look, or at
I
least to
see
have
what you're
hair
saying.
in like a wide area.
I
If
see
you
what
were
you're saying.
saying like I just want to increase the density of the goatee, then we could go down to probably like between 500 and 1,000. But if we're looking for really filling in the cheeks on both sides, they could easily consume like 800 per side, just in terms of graft number. And then you have to add in, increasing density in here. So it's a lot of grafts, even for someone who has hair already, and we're trying to just, make it more dense. Then you're
Right, right,
still looking at like 1,400 grafts, something like that. But in your
uh,
case, it would be more than that. I would say at
right, right,
least
right,
2,000.
right.
So it can be done, but I also would need to assess the back of the head because that's where the hairs would come from. And we'd need to shave an area. So we'd have to
Right,
make
right,
sure we have enough hairs in the back of the head.
right, 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 right.
Yeah.
Well, yeah, I definitely have a full set of hair back here. So,
Okay.
but
Okay. And
yeah,
you're
I
okay
see
with
your point.
yeah. Are you
Yeah,
okay with
yeah,
like a shave? Okay.
yeah. I
I
would
mean,
be
it's going to
okay.
grow back.
Hmm.
The method I use is called FUE. It's follicular unit extraction. So each hair is removed one by one. So the good thing is you don't get a linear scar across the back of your head. So that's the good
Right,
news.
right.
But there are little, tiny little scars that form throughout the area where we extract. But the trick is we don't extract from one small area. We kind of,
Right.
expand it out. So it ends up being really not noticeable. But we also don't
I
want to
see what you're
go
saying.
above a certain number of hairs because if I took like 4,000 from the back, that can be, quite noticeable. So it's just about balancing how many hairs we need to create some change that
Right,
you'd be happy with, and also making sure we leave enough hair on the back so that no one could tell that you had, a procedure.
right, right. Right.
So
That's what you
that's kind of the concept. But as long as you're okay with not a very full look on the beard area and just kind of having some coverage, then I think it's possible to do. Also keep in mind, Anubis, with very curly hair like yours, it's
hmm
technically more challenging. So
Okay.
it's just the way it is. It's a little harder to control exactly the angle that the hairs grow out of since it's like very
Yeah, I see what
curly.
you're saying.
Um, and so that's like, for example, I don't do eyebrow transplants on patients with very curly hair. And
Okay.
that's because it just doesn't, because you take it from the back and it's just very hard to create a very natural look. The
Mm.
beard is a little bit more doable, but you know, it's just all the kind of all the important sort of points to think about.
Right, right, right. I see your point. I
Yeah.
see your point.
And it's a
Okay.
big procedure, you know, it'll take for me to do 2,000 grafts for the beard from the back of your head. It'll probably take more than a day, actually. Probably have to bring
Mm.
you back for another half day. So a full day and then another half day
Right,
to get it done. So it's a big undertaking, you know, multiple assistants are needed
right.
for a procedure like this. So you know, some people, I don't know, like there's a lot of misconceptions with hair transplants, but one thing that it definitely is not is very fast. You know, it's a slow process. And then even once the surgery is done, you still have to wait almost a year for the hair to fully grow out. Usually at
Okay.
4 to 6 months, you can start to see some hair, and then it kind
Mm-hmm.
of grows from there.
Mm.
So that's the idea behind it. It's not very painful. We give you medications during the procedure to make you comfortable, and then
Right.
there's a lot of numbing, you know, numbing injections for the
Right.
procedure. So,
Okay.
but you're not going to be like fully out. You know, it's done under what's called oral sedation. So it's just like Valium and Ambien. So things that you can
Okay.
take as a pill, not like a you know injection into the vein or anything like that.
Right, right, right. Okay. Okay. So how would I follow up with everything
Oh, like
from
next
here?
step, kind of next
Yeah.
step. So, I mean, I'll talk to Bianca as my main assistant. So
Right.
we'll send you, we can send you a quote, and then you can just, you know, report back to us, let us know what you think of it, and if you have any questions. So it's just, you know, it's just a calculation that we do based on how many grafts I think you need and sort of the complexity of the case. And then you get a quote, and you know we'll talk to you about you know different if you need financing options. Some people choose that, some people don't. You know, so it just depends on
Right, right.
what works for you. And then you know then we pick a you know date and a time, and that's how we do it. Now it's tricky with COVID, so I'm
Yeah.
scheduling out into middle of June to late June at the earliest, and then you know obviously things are starting to get more filled up as we go further back as well.
Right.
But yeah, so we find something on the schedule. Like I said, I would need back-to-back days for you, so that I can make sure I have enough time so we can bring you back the following day to continue working because it will take time.
Okay. Okay. I'm definitely interested.
What
And
kind of questions do you have?
besides that, none going outside of everything that you told me. You definitely informed me with everything I needed to know, especially also the payment plan and the reality of it,
Yeah, it's not.
of
It's you
what I
know they're
need.
just yeah. I don't. Yeah, some people just need to be told like it's just not like it's not like going to get a haircut. You know,
Right, 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 right.
it's a real procedure. There are real risks. Someone asked here what are other options. Well, unfortunately, there aren't many, right?
hmm
So it's not something where you can get like microblading. You know, some for the eyebrows, some people get microblading
Right,
done, or for the scalp, sometimes I can do little pigments of ink. It's almost
right.
like a temporary tattoo. For the face, it's just not a good idea. It doesn't really look natural.
hmm
So, you know, you can't really do that. And otherwise, you know, I mean, you can try to put Rogaine here, but if you've never had hair there, it's not just going to grow. There really aren't too many other
Right,
options.
right.
Just kind of like a surgical hair transplant is your best bet. And like I said, I mean, it's gonna look like you've got hair. It's just not gonna look like super full, like someone who has, you know, like one of those lumberjack beards.
Right.
You know,
Yeah, yeah.
it's just not going to have that
Right,
extreme
right, right,
fullness. So,
right,
someone asks, does the procedure generate results that make it all worth it in the end? I mean,
right.
that's an excellent question, and that's very subjective. But I think it starts with having certain expectations. And if the expectations are realistic, then I think that the satisfaction rates are high.
Right.
But if the expectation is that it's going to be extremely full, then it's easy to be set up for disappointment. You know what I mean? Because it's not cheap,
Yeah.
so you got to be. But
Right.
that's a great question someone asked. So it's not. I would say it's actually the growth itself is actually quite strong. I mean, the percentage of hairs that grow is very, very good.
Mm.
It's typically not worse than the scalp, right? Because usually we take from the back of the head and we put it in the front, right? For
Right.
people who have kind of male pattern baldness. Now, for the beard, it's a similar sort of process, but for certain parts of the beard, a little bit more predictable than other areas. So, like the central area is actually less predictable in growth rate compared to the sides. The sides grow out,
Right.
okay. It's just, again, it's a matter of density. Can we pack in enough
Right.
hairs to give you, like a nice change? And I
Right.
think it's doable. It's just, got to factor that all of this in together.
I see what you're saying. Okay.
Yeah.
All right. Yeah, I would definitely like to follow up with everything and more information with you.
Yeah, this is not
And
something that's done, overnight. You got to think about
right.
it. We'll go back and forth, emails, and
Definitely.
if it all makes sense for you, I'm happy to help.
Definitely.
But yeah, and then also we just design things based on, we basically draw it out. We can have a couple of different, patterns that we look at, or if there's someone whose beard you really sort of admire, you
Right.
can bring in a picture or send in a picture, and we can sort of try to draw something similar, and that will help
Yeah.
guide how I make all of the little recipient sites for the hairs.
That sounds like a fun plan. Yes.
Cool.
Thank you. Thank you so much for
No
your
problem.
service.
Yeah. Nice to meet you. And so then, my team will be in touch, and we'll follow up with you.
Thank you. Thank you so much. Definitely. All right. And stay safe.
You too, man. Yeah.
All
Sounds
right.
good. Are you in the New York area, or are you somewhere further out?
I'm in New York
Perfect. Yeah.
right now.
Yeah.
Yeah.
Excellent. Awesome.
I'm
Well,
definitely in New
yeah.
York.
Be careful out there, and we'll be in touch.
Yes. Thank you.
All right.
Have a
Take care,
nice
man. Okay.
You
See you.
too.
Nice to meet you.
Bye-bye.
See you. Bye.